Hello, I am Mrs. Patel. Me and my husband, we are from Bombay. However, we had come here to my son's place for a holiday. After coming to Bangalore, he suddenly took ill because he has always had liver issue. It was cirrhosis and which was getting from bad to worse. He had to be admitted to ICU 3 times within a period of 1.5 months. Every 15 days, he used to just not get up in the morning. He would not recognize anybody, couldn't hear, couldn't open his eyes. And early morning, we had to just move him to the ICU in Manipal Hospital because that was nearest to our house.
So I'm Dr. Sanjiv Rohatgi. I'm the Chief Liver Transplant Surgeon at Manipal Hospital Whitefield. I would like to share with you about Mr. Patel, who was 72-year-old young when he came to me. And he had a lot of ascites and he was getting into encephalopathy every now and then. So here was the dilemma that at 72 years of age, whether we should offer a transplant to this gentleman who was very keen for it and wanted a transplant if we could. So I worked him up completely to see whether there is anything which we are missing, how his heart was, and how his lung conditions were, and then we decided to go ahead with him.
Dr. Sanjiv Rohatgi, whom we had consulted, he suggested that we should go in for liver transplant. The doctor was good enough to give us a full detail of how he would be performing, and the anesthetist also gave us a briefing about what will happen to him inside. Surgery took place from around 12 in the night to next day afternoon 12:30. The next day, we were called and the surgery was over, which was successful.
Patel, who had chronic liver disease with multiple decompensation. He was elderly, and rest of the world generally they don't recommend liver transplant. We thought that let us give a try for a liver transplant.
So when we worked him up for liver transplant, we were little worried that he would have some stormy course during surgery in the post-operative period in view of his age, who is probably one of the oldest to receive liver transplant in Karnataka. But fortunately, he had a very smooth surgery with minimal blood loss, and we had very minimal transfusion during surgery, and had a very smooth recovery in the post-operative period.
हेलो दोस्तों, मेरा नाम खुशरू नादिसा पटेल है यानी मेरी उम्र है 72 इयर्स और मेरा लिवर ट्रांसप्लांट हुआ है और अब मुझे बहुत ही अच्छा महसूस हो रहा है। मैं अच्छी तरह से वॉक लेता हूँ 30 मिनट तक और मैं खाता भी हूँ बराबर और मोशन भी रेगुलर आता है और नींद भी अच्छी से आती है। सो मुझे अभी बहुत चीयरफुल लगता है और मुझे जो पहले तकलीफ़ थी वो अब बिल्कुल भी नहीं है। तो मैं मणिपाल हॉस्पिटल व्हाइटफील्ड अंदर एडमिट हुआ था और वहाँ मुझे बहुत अच्छी सही ट्रीटमेंट मिली और डॉक्टर संजीव और उनकी टीम ने बहुत ही मेरे साथ बहुत ही ब्यूटीफुल से ट्रीटमेंट मुझे दिया है और ये सब के लिए मैं बहुत बहुत आभारी हूँ और मैं सबको बहुत बहुत दिल से थैंक यू कहता हूँ।
So it was a very successful story, to be honest. He came out of the transplant and was out of the hospital within 10-12 days. And here he is with me in 3 months down the line. And he is very hale and hearty and looks very healthy to me. I think he should live up to 100 years.
And we are very happy with the team of Dr. Sanjiv and the sisters and nurses in the OT as well as in the ICU who gave very caring attention to my husband. He has got a new lease of life. Of course, credit should also go to the donor and his family who very graciously gave us the liver. And we are grateful to him as well as to the doctors and the hospital. Thank you.